issue many women suffer but never talk about, but we're going to talk about it today. Urinary incontinence. Here to shed more light on the subject is Dr. Sandra Altman, a gynecologist at John Muir Health Center in Walnut Creek.
Hi, Dr. Altman.
Nice to see you.
Nice to see you. Thank you for being here. Now, urinary incontinence, is that the same as like an overactive bladder?
An overactive bladder is one form of urinary incontinence. Okay. We leak for a number of reasons.
Okay. So when does it happen, and is it normal?
It's not normal. It's never normal to have to spend your whole life worrying about where the next bathroom is. That really takes away from the quality of your life. It's very common. About 30 to 40% of women end up with urinary bladder control issues. It happens in a variety of different ways. Life is not kind to the female bladder. Between childbirth, which you almost were going to have.
Yeah, that's right.
Was it April
Except it was April Fool's joke, right?
Between childbirth, which can be damaging to the pelvic floor muscles and the support under the bladder, to the hormonal changes with menopause. The gals who were talking earlier were talking about hormonal changes. People don't realize the bladder changes with those hormonal changes. It loses elasticity. It becomes smaller. We're full. More quickly, we have to rush to the bathroom. Other illnesses that people don't even think about, diabetes, can affect the way your bladder functions. Multiple sclerosis can affect the way your bladder functions. So there's so many parts of life and aging that changes us.
Is it fair to say then that it's more common among women of a certain age? I mean, does the aging process make it more?
From childbearing age on.
Yeah.
Okay. Yeah, I always thought this was just normal. Like you would have to go to the bathroom more and more as you age.
And a lot of women think it's normal. I'm old enough to remember when we thought horrible menstrual cramps were normal and you just missed school and put up with it. Yeah. Now no one would think to do that. We treat that and we fix it. And urinary incontinence is really a treatable and fixable problem.
Okay. Is it preventable?
Preventable is a little harder, just because of there's so many different factors that impact it. One of the things that will help always is to exercise and maintain the strength of the pelvic floor muscles.
Right.
Okay.
Like any other muscle, like working your arm muscles, those are muscles that will respond to training and strengthening.
How do we do that?
You can go online and you can learn about Kegel exercises.
Oh, Kegels.
You can take a class and learn about it. And sometimes you, in essence, hire your personal trainer, which is what some physical therapists will do with you, to really help you learn where those muscles are and how to strengthen them.
Are there dietary changes or supplements that can be taken that might help?
I don't think supplements really help the bladder that much. Dietary changes and behavioral changes certainly will. We all walk around with water all the time and then wonder why we're always running to the bathroom. A lot of women get up many times during the night, partly just because of how much fluid they've had to take in from dinner onward. Certain things that we eat, spicy foods, very strong coffees will be bladder irritants.
Okay. So how do you know if you're just drinking too much water and you're eating too much spicy food versus
there's a real problem going on?
There's a real problem.
What it takes is actually sitting down with your healthcare provider, getting a real good history. Okay. What's happening? When do you leak? Are there other medical problems? Did you just have a car accident and injure your back that could be impacting it? There's another piece that so often is forgotten called urodynamic testing. Now, if you had abdominal pain, you wouldn't just show up in the doctor's office and he would say, gee, we'd like to take your appendix out. You'd say, wait, don't you want to do an evaluation first? And urodynamic testing is a way of measuring what's happening in the bladder. Is it too tight? Is it too relaxed? Right. Will it contract? Are you leaking? And then you can learn why are you leaking, which then helps push you in the direction of what kind of treatment.
Let's say you're leaking, you're doing the Kegel exercises. Are there other options like surgery or non-surgical?
Surgery, there's both.
Okay.
For women who have an anatomy problem, surgery can be a terrific answer. There's some wonderful new, what are called minimally invasive procedures that can be done as an outpatient. Sometimes biofeedback helps. There are a lot of very good studies that show that biofeedback is tremendously helpful. Sometimes using, if you're menopausal, vaginal estrogen helps the strength of that tissue and how resilient it is and how well the Kegels will work for you. Sometimes just learning to modify your behavior. The most common reason that I see in my individual practice, which is different than the Women's Continence Center, is my patients are just too busy to take the time to stop in the ladies' room.
Yeah.
Okay, so we should see, if we suspect that we may have this issue, we should see our gynecologist first.
Exactly. One of the things that is so sad is that we're all sitting there taking our grocery cart down the adult Depends aisle, you know, at Safeway looking for a solution, and that's not where you're going to find it.
Got it. Go to the doctor first. Dr. Altman, thank you so much.
Thank you so much.
Oh, you're very welcome.
Nice to meet you.